Pastor Chris Harris from Bright Star Church Chicago in the greater Bronzeville area. And welcome to today's edition of Clergy and Clinicians. Our show today is really exciting. It's about helping folks in the greater Bronzeville neighborhood and beyond understand health issues that affect them. And they're going to be answered by many of the leading experts from Northwestern Medicine. And today I'm super excited because we have an individual who looks like us. Dr. Yancey is my special guest today. And I think today is so important because if we're going to educate African Americans, it's important that some of that education come from an African American. And we have one of the best today. Dr. Yancey, how you doing?
I'm good. Thank you so much for the invitation, Pastor Harris.
Glad to have you today. Before we jump into some of the questions that I have, and I can't wait to learn from you today, can you just tell us a little bit about yourself? There's so many folks that are watching who don't even know the wonderful gift that's hidden there in Northwestern Medicine. Tell us a little bit about yourself.
Well, I'd love to introduce myself to all of the listeners, all the people at Bright Star and in Bronzeville. I'm Clyde Yancey from the Deep South, from Louisiana. I am inspired by the legacy of an incredibly strong African-American mother who was supported by a deep faith and willed me to succeed, no matter what, willed me to succeed. Product of Tulane School of Medicine, from there University of Texas, and 10 years ago, Northwestern invited me to come up in a leadership position. So I'm professor and chief of cardiology at Northwestern Medicine, and it's been a fabulous run, and the city has been my home, and I've been made to feel home here. So I'm happy. I mean, this is like a personal passion now to reach out to the good folks in Bronzeville. Thanks so much.
Man, I'm really, really excited about today because, listen, as an African American, when I go to the hospital, if I go to the doctor, it's a little bit different when you see someone who looks like you, and especially a male. That's a big deal. So you have two brothers here today getting ready to educate the community, and I'm so glad to have you as one of my guests here today. Now, listen, needless to say, 2020 has been completely different for all of us. And COVID-19 has shifted everything in all of our lives. And we've heard so much about COVID-19 in the last 7 to 8 months. Tell us, why is this particular virus so threatening?
I want to speak very clearly to this so the community actually knows the truth. First, this is not the initial experience with COVID-19. The virus that's responsible for this illness is one of the causes of the common cold, but different this time is that the virus has a twist in it, what we in science would call a mutation, so that it truly is novel, brand new, and it leads to severe respiratory disease, severe pneumonias. And that's been the weak spot for everyone. So the first thing to tell you is that it is brand new in this version of it, but it's not new to us. The second is that it is a principally lung problem causing pneumonia. And the third thing that is so profoundly important and cannot be overlooked is that we understand how this virus spreads from human to human transmission. Those are the takeaways that we can share with you right now.
That's pretty amazing. This is already informative. I remember in February, we first started to kind of hear about it quite a bit. March and April, it exploded on the scene and just blew us all away. And I remember in March and April, May a little bit, black folks were on social media saying, this one don't mess with us. It doesn't bother us. When you think about it, May, June, we started to realize that it is affecting and impacting our community. So I got to ask you, are African Americans at an increased risk for COVID-19 as compared to other races or ethnicities?
So Pastor Harris and everyone that's listening, I want you to lean in for a second because I want this answer to be very clear. Yes, African Americans, blacks are uniquely at risk. Pastor Harris, I'm going to share some numbers with you. Here's the first number. Blacks are 4 times as likely to die from COVID-19.
Wait, hold on, Doc. Hold on. Did you say 4 times?
That's why I use my fingers. 4 times as likely to die from COVID-19. Let me give you another number.
Please explain why.
Let me give you another number. 1 out of every 1,125 blacks in America is now dead from COVID-19. Think about that. You raise the question, why? You want to very quickly go to race or something about race. Let me be very clear. There is no biology that puts us at risk. It is our life and living circumstances. When we live in communities that have been marginalized, communities without economic opportunities, communities without educational opportunities, where housing is a challenge, where good nutrition is a challenge. You and I have talked about this before. When that's the life and living circumstance, the likelihood of high blood pressure, diabetes, obesity is very high. And guess what are the predisposing traits that make you more vulnerable to COVID-19? It's age, but then obesity, hypertension, diabetes, and any kind of pre-existing heart disease. So that's a setup. But here's the other thing that makes blacks particularly vulnerable. Many blacks are unable to work from home. They hold essential jobs. I have been told by persons in the business community that 8 out of 10 blacks that are employed hold an essential job. So you've got to get up and go to work throughout all of this. And you typically are taking mass transit, public transit to go to work. That means that you are triply exposed. You're exposed in your community, you're exposed in public transport, and you're exposed at work. And if this thing really does communicate human, boy, the setup is powerful. And as a consequence, we see the burden of this disease.
Let me tell you, I love what you just shared because it kind of destroys some of the myths that African Americans are out here being reckless and irresponsible. You just exposed some truth that a lot of people probably really don't understand, and they don't understand the cultural issues a part of this as well that's contributing to the spread. Let me ask this, are there any root causes that are related to biological traits?
None whatsoever. None whatsoever. And we have been searching, looking, trying to identify, is there a signal, a trigger, something that we can use as a switch to reduce this burden? And this switch doesn't exist in biology. It exists in sociology. Again, it's the life and living circumstances. That's where the switch is, Pastor Harris.
All right, so let's just bring it home for a moment. And let me just be a little personal here. You know, everybody since George Floyd, and now Breonna Taylor, they're marching and they're pumping their fists saying Black Lives Matter. But I'll be honest, it doesn't always feel like that. I don't always feel like politicians feel that way. I don't always feel like the philanthropic community or the corporate community feel that way. I don't even always feel like our community feel that way. And we got to touch on that a little bit. And we are just being slammed from every which way, right? Lack of world-class education, lack of access to care. And when you think about it, all of the social unrest, man, we're dealing with some real heavy stuff that impacts us, you know, emotionally, psychologically, physically, financially, and every other Lee you can come up with. We're being impacted by it in the African American community. And our mental health is a real issue. And that's why we deal with trauma counseling. And I always say to people, Doc, say nothing until you do something about violence and trauma. Can you help us understand how we can address the mental health of African American people in all that we're facing? Sorry to get so personal, but hey, this is my opportunity to just keep it real.
No, we have to put it out there. I mean, we have to deal with this. You know, there are people that will say, why on earth is a cardiologist getting into this social conversation? For this reason. What we've learned this summer is that all policy, public policy, law enforcement, everything we touch has a health consequence. So I have to get in this space because I am a custodian of other people's health, and I want that health to be as good as it can be. But here's the deal. Yes. We've been bent, we've been bowed, we have cried, I have cried, we've been killed. It has hurt, and it has almost destroyed us. But you know what? I am not broken. You are not broken. The Black community has a heritage of a strong foundation. We are anchored. We're anchored in some seriously good stuff, and you're one of the purveyors of that seriously good stuff that anchors us. I really take a lot of solace from a song that was articulated back in the 60s. Sam Cooke, a change is going to come. A change is going to come.
One of my favorite singers.
We just have to hold on. We have to hold on. It's what we've done to get from one era to the next, and it's how we move forward. I admit it has been painful. I have felt pain. It is difficult. It is wrong. But we got to hold on, man, because what we have is so valuable. This heritage that we share is so important. The necessity to enable our next generation is something that we cannot walk away from. We have a duty to make certain that our next generation understands how important our heritage is. We cannot let the losses, Breonna, George, Aubrey, we can't let those losses just disappear. We have to leverage those losses. They need to become catalysts so that that heritage that's so important, that foundation that is so deep, helps us get to that next place. A change is gonna come.
Man, you are teaching us today, and I'm super excited. You know that book that I love to preach and teach out of? You know, it says, we perish for the lack of knowledge. And I think that's really, really important today. And I want to ask you, we know what's going on, but let's shift a little bit. What are some of the ways that our community can take action to prevent the spread of COVID-19? And are there some specific recommendations for protecting ourselves? And we certainly have the responsibility to protect our loved ones. What are some of your recommendations?
So first, thanks for the shout out about protecting your loved ones. If there's no other incentive, let that be your incentive. Children should protect their grandparents by being careful, and adults should protect their parents and their children by being careful. Let me deal in fact. There are a lot of things that are discussed in the broader social environment, but let me deal with fact. Fact number one, this is human-to-human transmission, and it comes from exposure where one inhales the virus. So the face covering is essential because it interrupts your ability to inhale the virus. That's fact. Fact number two, this virus is airborne, but it can only move about 6 feet. So the physical distancing, not social distance, the physical distancing at 6 feet protects you. So keeping a 6-foot perimeter around you, if you can, is very helpful. We still advocate hand washing. At the beginning, we thought that this virus could last quite a long time on surfaces. Probably isn't as important as it used to be, but you know what is important? The hand washing encourages healthy behaviors. And those healthy behaviors...
Now, Dr. Yancey, wait a minute. Dr. Yancey, I gotta tell you, listen, man, my hands are washed so much that, you know, they look like I've been boxing with powdered donuts. Man, I'm tired of washing my hands. Is that helpful?
So I understand the fatigue we have for everything. I mean, the masks are not cool. They don't look good, and people are tired of wearing them. The physical distancing, you got to shout at the next person. It all seems so awkward, and the hand washing seems so troublesome. Hand sanitizers, provided they've got alcohol, another option. But the key consideration is that we're still in it. We're not talking past tense. So you know what, Pastor Harris? We don't want COVID-19 because these eyes have seen what it can do to people.
Yeah, absolutely. You know, I got to tell you, this has been a learning way for me as well. And one of the things that you taught me, I will never forget it. It actually shifted my paradigm of thinking on this. You taught me the difference between looking at it from a social distancing perspective versus a physical distancing perspective. Can you talk a little bit about that?
You know, this is really important because what we're trying to do is not only prevent the infection, but prevent the consequences of living this life. Let me explain. If someone doesn't come to the hospital because they're ill, that can be a bad outcome. If someone doesn't take their medicines because they're getting tired, or doesn't follow the usual advice because it seems worthless, they become ill. And if someone actually feels isolated and doesn't feel connected with the people they love, goes internal, becomes depressed, becomes sad, we know that that's a risk factor for heart disease, without any question. And so we've got COVID-19 wreaking havoc on our community, but we have the life experience of dealing with COVID-19 doing the same thing. And so it is about physical distancing, but don't isolate people that you love. That's not a good thing.
Yeah. You know, a lot of the work that we do at Bright Star Community Outreach, you know, deals with mental health and trauma. And I want to encourage folks, if you have been impacted by COVID-19, you can call that number, that helpline, and our advocates and ambassadors are ready to support you emotionally and even psychologically. You know, I got to ask you, what are some of the recommendations for coping with mental health impacts of COVID-19? For example, that social isolation. I got folks who are just stressed out because when they come to Bright Star, they can't hug the way that we used to. How do we deal with that? And what are some of the ways that we can stay socially close while remaining physically distant from our friends and our families?
So 3 things, Pastor Harris. First, be aware. Understand this conversation that you and I are having and sharing with the community. It's telling you it's okay to feel stressed. It's okay to feel isolated, but it's not okay to not do something else. So the first thing is to be aware that it's there. The second thing is to speak up. I love that you've got resources and you can say, you know what, if you're not feeling well, if you think that there's no hope, call somebody. And the third thing, you know, our communities thrive on the family. Stay connected. Check on the people you love, check on the people you know, stay connected. Those are simple things any of us can do.
Yeah, you know, there are a lot of folks who are trying to handle this on their own. For example, you know, the dangers of self-medicating. You know, I'm constantly discouraging people saying, listen, you don't have those answers. You got to touch on that just for a moment right before we go to a break.
So we have to be very, very clear here. Everyone should lean on medical advice and sound science. The stuff that's the home remedy, that's the hearsay, it can get you into deep trouble. So if you're on a medical regimen, you're taking medicines, you're following a certain lifestyle, don't fatigue, don't retreat. If you have a question, just like they can call you about their mental condition, call me about your health condition. We have an army of people at Northwestern Medicine and all across the city at every healthcare entity to say, we want to help you. We want to get rid of the mystery and help you deal with this as best you can.
Man, Doc, I thought I was the preacher. It sounded like you preached today, and it's good to be on this side to be able to say amen. You know, as a faith leader, I got to tell you, I want to make sure that people understand your faith should not make you act foolishly. We have to understand that when we get this kind of knowledge, we have to implement it. And all of this information you've given us so far is absolutely fascinating. We got more to come, but let's take a quick break, and we will be right back with more questions and answers with Dr. Yancey on today's edition of Clergy and Clinicians.
It's inevitable that all of us are going to experience some type of trauma, but how we handle it dictates how it affects us.
The TURN model is science and data informed, but still community led.
That's why we decided to take faith and community leaders, identify, train, and certify them to provide trauma counseling based on the Israeli model of Natal.
To fund and support BSCO is to fund and support the greater Bronzeville community.
Please visit brightstarcommunityoutreach.com for more information.
My friends, we are back. Again, I'm Pastor Chris Harris of Bright Star Church Chicago in the Bronzeville area, and I want to welcome you again to today's edition of Clergy and Clinicians. I'm having so much fun with Dr. Yancey. Dr. Yancey, you doing all right over there?
Good, and I'm loving this Clergy and Clinicians. Let's not let this be the last time we do this.
Oh man, listen, you stuck with me now. Listen, we down like 2 flat tires. We're having a lot of fun with this. You know, we're learning so much about this COVID-19, and in Europe, on college campuses and some states, you know, we're seeing an increase, or what they're calling a spike, you know, in those numbers, in the COVID-19 cases. What can we do here locally to make sure that we avoid an increase? And I believe that some of these principles that we learn from you locally will also impact people in other cities that are watching. To educate us a little bit more, what can we do?
So the first thing we can do is don't give up the fight. Don't stop doing the good stuff. And the good stuff is simple stuff. It's the mask. It's the physical distancing. It's the hand washing. Because in those places where there was some relaxing of just those personal protective strategies, then we're seeing the virus reemerge. And in Europe, it's getting back almost to peak thresholds again. But there's a good story here. You're looking at Europe. Let me tell you what's happening in Australia. Australia is the presage of what we can expect during our winter season in terms of the flu. They're having record low numbers of persons with the flu. You know why? Because they are washing their hands. They are practicing physical distancing. It's bringing the flu intensity down, and they got vaccinated. This is something we can kind of put in our head and say, you know what? There's a good model. Europe is a model that's not working out so well. That's a challenge. Australia is a good model. If we do these things and take the vaccination, there's a good chance that we can tamp this down. So we should really think about that.
So, Doc, we don't have to go and get a ticket to go over to Australia. We just need to make sure that we learn from them and bring some of those principles home locally, right?
I want to be very clear with you, the members of your congregation, and the members of the community. I'm talking about black people now. That's why I'm leaning forward and I'm wanting you to lean in. We don't like taking a flu vaccination. No. This time through, I want everybody to realize, roll the sleeve up, take the vaccination. We can't play with this. We're trying to avoid what we're calling the twindemic, flu and COVID-19. Get the vaccination, period.
So wait, Doc. Now let's be real here. You know, since the days of Tuskegee, you know, black people don't trust medicine, academia, certainly research, and you know, not to be political in any way, but when you look and listen to different folks, there are different messages coming from leadership, whether it be nationally, globally, locally. You know, it's confusing. How do we build that trust to understand that this is important? And then when you look at social media, let's talk about youth for a minute. You see folks jumping into swimming pools. You know, it's a little tough to tell me to stay at the crib when I see folks, you know, vacationing and kicking it and what the young folks call turn up. You know, how do we deal with that? And how do we, you know, give a greater image to our younger generation to say, you have a responsibility to be more responsible, not just for your loved ones, but for anybody in our community?
So, Pastor Harris, you just talked about all the images that are influencing people, social media, Twitter, etc. Look at this image right here. Look at this image. I come from a very simple place. I come from a place where we had to work hard to just get from one day to the next. I am a black man. I am a researcher. I am a scientist. I am in academia. And I'm looking at you with the most sincere thought I can possibly muster and say, based on everything I've studied, everything I've learned, everything I've published, there is nothing more important to my community, people that look like me, than to get the flu vaccination. I put my word on this. This is the one thing you can do that will help you. This is it. Get the vaccination.
You know, every Sunday, every Wednesday, every time I'm preaching and teaching, I try to challenge people. All right, so we're going to reverse the roles for a moment. And I'm going to give you an opportunity to challenge people like me, the faith leaders. What is the black church's responsibility? What is the black faith leaders' responsibility? What is the message that we should preach? What is the gospel according to Dr. Yancey addressing COVID-19 and the flu? If you had the pulpit, what would you preach?
So here's what the gospel in the neighborhood should be. The trusted voices in the neighborhood need to come together. Who are the trusted voices? They're the people that make us look good, the hairdressers, the barbers. They're the people that make our souls feel good, the churches. They're the people that teach our children, the teachers. We need to come together. I challenge you and your peers. Form a coalition, not just of ministers. Form a coalition of ministers, hairdressers, barbers, teachers, daycare workers, the people we trust with our souls, our children, our parents, and say, we're going to come together, we're going to wrap arms virtually and say, this one time, we want to be in sync with the same message. Folks, the vaccine is necessary. It is necessary.
You know, that's really tough, man. I thought about getting the flu shot, and I'll be honest, I'll confess, you my priest today, you know, I didn't want to get the flu shot. And yeah, I wasn't having it because in my mind, out of ignorance, I would say, well, why would I take a flu shot, get the flu, so I can prevent the flu? You're telling me today that I need to get the flu shot. And let me just ask you, does the flu shot do anything to prevent COVID-19? And while you're at it, go and tell me, what's the difference between the flu and COVID-19?
So the flu shot prevents the flu, influenza. We make a mistake and we believe that the common cold, even a bad cold, that was a flu and, oh, the shot didn't work. No, it worked. Influenza is the bad one. Because very quietly, you know what? This year, influenza has killed 20,000 people. COVID-19, 200, but influenza has killed 20,000 people. So it's a serious condition. They both are viruses. One is due to influenza A. The other is due to coronavirus. So we have to realize that there's no crosstalk here. We have to get vaccinated against influenza A, and we hope to be able to get vaccinated against coronavirus. I can't stress this enough. We have paid a dear price, we being Black Americans, due to coronavirus, due to COVID-19. We can't continue to pay this price. We're losing our families. We're losing our heritage. We're losing our talent. We have to step up and do this.
Man, you have really educated me today, and I certainly hope that many of our viewers today are being educated. And I just want to remind us that the Bible, it tells us faith without works is dead. So if you were a, Baptist preacher, they got 3 closes. But Kojic preachers, we say we got 3, but sometimes we take 6. So I'm going to give you an opportunity to close today. Give us some final words of advice, of anything else that you want to add, and make sure that our community is aware of ways that we can stay healthy.
Think about the Black experience. Think about how robust, how rich, how culturally beautiful the Black experience is. It's worth preserving. It needs to thrive. This one time, let's stop being a casualty. Let's do what we know to do that will help us embrace that culture, embrace that heritage, and pass it on. We need to prepare for the next generation. And I want the Black experience, the rich, beautiful part of the Black experience, to survive COVID-19. And the only way that will happen is that we survive. And I've told you exactly what it will take. Mask, hand washing, physical distancing, and a vaccine.
I got some educators in my family, and they would say you're not a good teacher unless you give some homework. And so I want to ask you to help us. You've given us information. Now let's flip over to application. Are there some trusted resources that you would recommend for health and assistance with COVID-19?
Well, I think Bright Star is one of the most trusted resources in the Bronzeville community. And let me just tell you, in front of everyone listening, I got your back. If you need some information, I will be certain that it's on the Bright Star website. I got your back. Northwestern Medicine is in partnership with you, and we want you to be able to disseminate the best information there is. So there you go. I'm putting my chip down and say, I got your back. You can count on that.
Listen, I want to thank you for that plug, my friend. Dr. Yancey, I also want to encourage folks, they can also get more information at nm.org/COVID-19. And like you said, at our website, brightstarcommunityoutreach.com. I also want to encourage folks to call the Northwestern Medicine COVID-19 hotline. It's 312-47-COVID. Again, 312-472-6843. My friends, I want to tell you thank you for tuning in today. Dr. Yancey, man, you my man, 50 grand. And I want to thank you for helping us today to keep our people informed, keep them inspired. And when it comes to saving our community, they got to go a little further. They got to get involved. Thank you for tuning in to today's version of Clergy and Clinicians.
I'm Shay from Peoria, Illinois, and I am a survivor thanks to Northwestern Medicine. Heart failure is a serious issue, but you can survive it. I'm a single mother of 2, so I was scared, nervous. The staff at Northwestern was awesome. They were honest and truthful with me with everything that was going on. I am better because of Northwestern Medicine.